Good evening, everyone, and thank you for joining for this media briefing. I am Lisa Lord from the Public Affairs Department. We will be addressed by the Minister of Health and Wellness, Lieutenant Colonel the Honorable Jeffrey Bostic, as well as Mr. David Leacock, the Director of the Psychiatric Hospital, Dr. Brian McLaughlin, the Senior Consultant at the Psychiatric Hospital, and Dr. Kimberly Phillips, the Medical Officer at the Brantford Tate Polyclinic. We will be addressed first by Minister Bostic, who will make a brief statement.
Thank you very much, Lisa. Good evening, everyone. I start on a sad note this afternoon, as I regret to inform you that Barbados has recorded its 45th COVID-19 death. The deceased is a 63-year-old male who was admitted to the Harrison Point Isolation Facility on the 23rd of April and subsequently intubated and ventilated for 6 days for severe acute respiratory. So on behalf of Prime Minister Motley and the entire COVID-19 team, I extend our sincerest condolences to the family and the friends of the deceased. I would also like to take this opportunity to extend condolences to the several members of the Indian population residing here in Barbados who are losing family and loved ones almost daily in India due to the ravages of the pandemic. This is indeed a most difficult time for all of you and for humanity, and we stand shoulder to shoulder with you and the people of India as we unite to fight this virus. I would have alerted you on Thursday of an outbreak at the Psychiatric Hospital. Since then, aggressive contact tracing and testing have been in progress. We have completed the first round of tests for the persons on the impacted ward, as well as the other wards of interest, and we've established an isolation center on the compound of the hospital, which is being managed by the Queen Elizabeth Hospital Isolation Facilities team. Mr. David Leacock, Director of the Psychiatric Hospital, will give you some details relating to the testing and quarantine situation at the hospital, and that will be followed by Dr. McLaughlin. David?
Thank you, Minister, and good afternoon, everyone. Relative to our current circumstances, to date, as Minister mentioned, we have tested all 82 clients on the ward in question, as with all 25 staff for that ward. Those 25 staff are now currently in government quarantine facilities, waiting their second test, and that should be completed tomorrow. Those 82 clients I mentioned are also going to be tested tomorrow for their second test as well. The other wards mentioned by Minister, we have at this time also tested all the clients on 4 other wards, with the exception of one client who declined to be tested. That one client who has declined will be maintained in isolation or associated quarantine until such time as 14 days have passed that we can be sure she's no longer infective. All other persons I mentioned have been tested, and those tests have all returned negative tests at this time. I'll pass on then to Dr. McLaughlin, who can give you more insights into what has been happening.
And good evening, everyone. We have determined certainly that approximately 29 patients were discharged from the A ward beginning from the 1st of April. Of those 29 patients, 4 have been readmitted and were readmitted during the month back to the ward. For 24 patients, we have been able to make contact with either the client themselves or their relatives and have determined that they have been well, but we have asked for them to return, not so much return, but to present themselves for testing so we can have them cleared. There are 5 clients that we have not been able to make contact with as yet. We have today asked our community mental health nursing team to visit those patients so as to inform them that we need to have them tested, as well as to check on them and to ensure that they are well.
Thank you very much, Dr. McLaughlin. We go back now to Minister Bostic.
Thank you. Today's dashboard would have reported 15 new cases out of a total of 353 tests that were done by the Best Dos Santos Public Health Laboratory yesterday. Of the 15 positives, 3 are from the Psychiatric Hospital, 2 male inpatients and 1 male outpatient. The positives also include a family of 8 from a St. Michael community, and this is following another family member who had tested positive earlier. This is indeed of great concern to the team, and contact tracing is now in progress. Today's results produce a positivity average of just under 5%, which is much higher than the average for the last 7 days of 1.5%. Of interest also is the fact that as at the 1st of May, we averaged 31.3 cases per 100,000 population over a 14-day period, bringing us closer to our target of 25 per 100,000. So that what we are seeing is an improvement in the overall situation in the country, but there are still what they call pockets of resistance, and resistance which we must pay close attention to. And this is the case with this pandemic. We are adamant that we will not retreat or surrender, but the pandemic is not going away in any easy fashion. So we have to be on our guard, and we have to continue to work assiduously on behalf of the country, making sure that we all do what we have to do in observing the protocols. What I would say is that at this time, the world, as you know, is going through a very serious moment with the pandemic. We are improving in our situation, as I said, but we still have COVID in Barbados. And I believe one of the things beyond everything else that we have been able to do and we will continue to do going forward is the fact that we must strive very hard to reach herd immunity in terms of having the percentage of our population vaccinated that would allow us to do this. Because once we've been able to do that, combined with all of our other efforts, this would allow us in this country to be able to return to a state of normalcy of some sort, but not only to return, but to sustain that. Because what is happening here is that, yes, we are approaching the 25 per 100,000 of population, which is the target, but once we've achieved that, and we will, then we have to be able to sustain that. And we are only going to be able to sustain that by continuing to do the right things, each and every one of us. The Prime Minister would have said on several occasions that we have a gas and brake policy in terms of where we're going, in terms of the measures that we're going to implement, and we've been implementing. This is a concern, but it's not a concern that would cause us to have to go backwards in terms of restrictions. We will continue on the current path where that is concerned, but it is a reminder to all of us that COVID is still in our communities, even though in pockets of communities. And so we still have to do what we must, which is to continue to unite to fight the virus. The situation at the psychiatric hospital internally is under some measure of control, and I say some measure because we still have to await the second test. But from the first test, we are satisfied that we've been able to do a level of containment that is necessary. And what we are working on right now, especially, is to be able to complete that process within the psychiatric hospital, and also tighten up on all of the loose ends in relation to outpatients who we are contacting and trying to trace to make sure that we could wrestle this problem to the ground. So that is it in a nutshell in terms of our reporting, and I await any questions myself and my team. I also have here with me Dr. Kimberly Phillips, who is the Medical Officer of Health responsible for the Brantford Tate Polyclinic, and also the medical officer that we have assigned to deal with this developing situation at the psychiatric hospital. Over to you, Lisa.
Thank you very much, Minister Bostic. And as you indicated, we will now go to members of the media. Joining us are Marcia Gittins from the Barbados Advocate, Barry Allen, the Nation newspaper, Trevor Thorpe from CBC, and Randy Bennett from Barbados Today. Your questions?
Just for clarification, can you tell us the family of 8, would that be considered a separate cluster, or is there a connection with that family to psychiatric hospital infections?
Thank you. At the moment, we cannot say that because the matter is still being investigated. There have been some challenges in terms of getting to all of the persons, but that is ongoing as we speak, and I'll be in a position to speak to that perhaps within the next day or two, but contact tracing is in progress and we are unable to make that determination at this point in time.
Hey, good afternoon, Randy Bennett from Barbados Today here. Just one question for Mr. Leacock. I'm just wondering how the outbreak has affected the operations of the psychiatric hospital. Is it still open for visitation as the hospital partially shut down? Could you just give me a brief understanding of how the outbreak has affected the hospital?
Okay. Good afternoon, Randy. Prior to the actual outbreak, we had already reduced visitation to the hospital, so that's not been impacted. Operations, otherwise, as far as services, have not been severely impacted. We still continue to give care at all levels. Our outpatients clinic remains open, and our community services continue to function as normal. And as we said, we have been supported by Ministry of Health, whether it's QEH or the polyclinics or district hospitals, as far as staffing is concerned, to ensure that we can give care internally uninterrupted at this point in time.
Just one question for the minister. Could you give me an update on the situation at the Queen Elizabeth Hospital? We know there had been some issues there as relates to the cluster from the church in the north. Could you just give me an update on how the Queen Elizabeth Hospital is operating right now?
Yes, certainly. I can say to you, as well as we would have indicated before, the situation really is a result of some positives amongst members of the QEH security staff, both private as well as public. And what we have seen is that a number of those persons have been able to return to work having tested negative on their second test. There have been no further positives coming out of that particular situation. And we believe that as soon as we are able to complete all of the second tests for everyone associated with that, if it continues on its current trajectory, that we would be in a position to close off that case. But at the moment, things are looking good. As I said, some members have returned to work, and we hope that that will continue over the next few days.
Trevor Thorpe. Any other hospitals that are being looked at since we're paying some attention to the psychiatric and other hospitals? What's the position with other hospitals?
There are no known cases at the other hospitals. We had one situation with a general worker at the geriatric hospital, St. Michael District Hospital, but that is under control, and we have been working with all of the hospitals and all of our facilities to ensure that persons continue to work in accordance with the protocols, and that the established protocols at facilities are being adhered to by everyone, staff and visitors alike. And at this point in time, there are no issues that I can report in relation to any of the other hospitals.
Has the Ministry of Health closed, or do you believe the northern cluster, that investigation is now closed?
Definitely not. That is still ongoing. We are still picking up 1 or 2 cases connected to that cluster, and we will continue to follow that for the next few days and for as long as possible until we are satisfied that it is closed, but it is not at this point in time. It's very much ongoing.
Any further questions? If there are no further questions, I'll ask Minister Bostic to close at this time.
Yes, thank you, Lisa. I want to close by saying and just trying to encourage each and every one of us to continue to do what we have to do to help Barbados, not only to maintain the current situation, but to improve and to get where we're striving hard to get to. I believe that for the most part this is happening, although there's evidence to suggest that some people are still dropping the guard in terms of the wearing of masks in public spaces where they ought to be wearing masks. And this is something that we have to be very mindful of going forward. Each time we get a little spike, whether it's 10, 12, 15 cases, and we've had 1 or 2 of those, I believe that that serves as a reminder to each and every one of us that COVID is still in our communities. It is still here with us, and it only takes 1 case that gallops away in terms of the contacts or the persons exposed to that case that can cause us trouble, and we do not want that to happen. So it is in everyone's interest to continue to wear the mask when you have to wear the mask, continue to sanitize, continue to maintain the physical distances, and continue to cooperate with the authorities, because this is also important. But let us stay focused and let us do what we have to do on behalf of our country. Thank you.
Thank you very much, Minister. Let me thank again the Minister of Health and Wellness, Lieutenant Colonel the Honorable Jeffrey Bostic, as well as Mr. David Leacock, the Director of the Psychiatric Hospital, Dr. Brian McLaughlin, the Senior Consultant Psychiatrist at the Psychiatric Hospital, and we were also joined by Dr. Kimberly Phillips, the Medical Officer of Health with responsibility for the Brantford Tate Polyclinic. Members of the media and you for joining. Good evening.